So we're starting with Chris Hermann, who is a nurse practitioner. He served at the John Dingle VA Medical Center from 2001 to 2019. Prior to that, he was in the Henry Ford Health System, where he received his RN in 1979. He did his undergraduate work at the University of Michigan. He's been nationally recognized by the Secretary of the VA and received awards for excellence in advanced practice nursing. He's also received awards from the American Academy of Nurse Practitioners. His table mate today is Brigadier General Carol Ann Fausone, retired. General Fausone's been a nurse for over 40 years. She served her country for 36 years and retired in 2011. She continues to serve veterans as a veteran advocate, with working both one veteran at a time, trying to solve world peace that way, as well as advising legal help for veterans, and is our chief fix-it officer on VA roadblocks. So she's probably seen every roadblock that VA has put up. She served as the Assistant Adjutant General for Veterans Affairs from 2003 to 2011 under the Granholm administration. Earlier today, we had Director Adams here under the Whitmer administration, and Carol Ann had a similar job back under the Granholm administration. She has her nursing degree from the University of Michigan and graduate's degrees from Madonna University here in Michigan.
We'd like to talk about the Mission Act, which has now superseded the Choice Act. The Choice Act has gone away, and as of June of 2019, we have the Mission Act. I would like to say I believe the VA is putting all of their eggs in this basket to say they have figured this out, but it's pretty difficult to navigate. So we're going to try to help you, and then with time, we would like to answer any of your questions that you have for us today that maybe have not been answered. So, Chris?
I think the thing, you've got the summary of the VA fact sheets. I think that's the best way to start. It is a process, and anytime you get the federal government involved in any type of process, it's going to be very similar to any of you who have private health insurance that need to get a referral somewhere. You know how long that takes. From my understanding, you need to go through your primary care provider, or let's say you see a surgeon who says, listen, I think you need to have this surgery, but here at the VA, we cannot best serve you, so you should see someone in the private sector. That surgeon should start the process. How many of you right now are already established with the VA in one way or another and have a primary care provider? How many of you know the nurse who partnered with your primary care provider? I strongly encourage you to find out who that individual is, or their medical assistant or tech. They are the ones who know how to run the system.
On your team, you should know all those elements. You should know your nurse, your doctor. Your social worker is the one that if something is not going right with an appointment, getting something extra scheduled, that you could call that person and say, Jill, Mary, Kasha, help me. I was supposed to go see this appointment, go for this appointment. I did do it. I didn't get any follow-up. So you should know those team members and what team you belong to. So don't be afraid to ask. You deserve to know those answers.
When you see your healthcare provider at the VA, when you check in, ask who the social worker is assigned to your team. I was a nurse practitioner at the Detroit VA for 18 years, and the primary care team I had worked as a team. And so, but the social worker isn't always that individual that you're familiar with. But when you go in and talk to your primary care provider, find out, say, listen, for future reference, who's the social worker assigned to this team? Who's a nurse that I can contact? My Healthy Vet is the online system to communicate with your provider at the VA. When you go in and see your provider, have a list of what you want accomplished. You are supposed to be running that visit, not the other way around. Start with the list. I need to do this. I want this, this, and this answered today. But you should be running any visit. When you're seeing a specialist, what's this? What's that? Write that down so you get those questions answered. If you use My Healthy Vet, send an email, say, listen, I'd like my social worker's number or email address. And I think that's the best way to do it. And if you don't get an answer, go to the social work office.
There is a line on the card that I received. I just did it, and so I was the guinea pig recently. And so that's how I know the team color, go to the nurse. Then I was introduced to the social worker, and I didn't even tell them. All I did was my name. I didn't tell them my rank or anything. And so they walked through me what appointments and everything I should have. And yes, then the social worker's name got written on the cards. I like Chris's idea to go to the social worker, but I'm gonna say to you, before you do that, go to your team chief nurse. So if you're red team, purple team, green team, go to the nurse. The nurse will help you find the members of your team and how to help you. And they might even tell you, as Chris said, with the Mission Act, you might now, if you're established, you might be making your own appointments, okay? This also happened. So the next question I had is, so I call, what information do I give to schedule a mammography? And they're gonna ask me, who's paying for it? Where's the authorization form? And they said, oh my gosh, you're right. The authorization form has to hit the office that you're calling, or else guess who's gonna pay? The veteran. So follow through and ask the questions. How am I supposed to do this? And the blue sheet kind of explains it a little easier regarding the process. It's brand new for them. There's going to be chinks in this armor. Things have already fallen through the cracks in some areas. But I do believe Ann Arbor and Detroit is trying to assist our veterans.
Well, I used to do this. I think it ticked off a few people in the payment office. But the process was I would put a consult in for non-VA care. It went down to some office. If in a couple of weeks the veteran didn't hear, they'd call and I'd look and say, oh yeah, it says right here that it was approved. Here, let me print this off that says it was approved, and now you can go down to that department because somebody forgot to call you. It does require responsibility on your part too. Those of us who are married and have a good CFO, secretary, woman of all stuff, frequently will be benefit from there too. By the way, wives of veterans, raise your hands. The wives of the veterans.
Thank you for coming.
Yeah, well, not to mention the fact you two are also veterans, even though you don't get it. I just want to make sure you're aware of that. One other thing I want to mention real quick, because this was just effective September 9th. The Federal Appeals Court ruled that the U.S. Court of Appeals veterans claims must now reimburse for emergency care at non-VA facilities. So any of you who have outstanding bills from 2016 now, you went to an emergency room because you had an emergency. So drive into Ann Arbor, drive into Detroit, really wasn't a thing to do. If you are getting bills for those and they've been denied, they are supposed to be reimbursed.
If you go to St. Mary's or something, instead of driving to the Ann Arbor VA because you're afraid you're never going to make it, you think you're having a heart attack, you go to the closest place. If you are admitted, your loved one, you need to tell the staff there at that hospital, please call the VA. That's my primary purpose. When you become stable enough, then they could transfer you. But that is so that you don't have to incur the bills. I'm fighting a couple of those right now for our veterans who say, it's always great that you have the evidence of who you spoke to, what day, and what time, because the VA ended up paying something like $100,000 for your hospitalization. But if you don't have that evidence, it's really hard to continue to fight for that when you didn't live up to the rules of notifying the VA.
I would let your primary care provider know, say, listen, I was in urgent care last night or whenever because this happened. I would always document that in the record. That way it is in there. I'd rather be safe than sorry on those types of things. It's also good continuity of care.
I would say the person would need to notify the, let's say, Ann Arbor VA, Detroit VA. It's a good practice because they still could refuse paying that bill. Now, one happened the other day, and honest to God, your question, honest audience, I didn't tell him to do this. A veteran called, said he wasn't feeling good, he was just gonna stop it at the Urgy Center. He goes to Ann Arbor. He gets to the Urgy Center, his diagnosis and his issue is much bigger than he even thought. He was transferred in an ambulance to the local hospital. All of that, they notified the VA immediately because the ambulance costs, the hospital costs, everything will now be authorized. So, you know, don't go into an Urgy Center because you've been sneezing for 7 days and all of a sudden you decided I have a little bit of time and I'm passing. Please use common sense if you want this to get approved, because they do have the right to deny. To notify the VA, if I go to an emergency room, I believe the answer is 48 hours, but if you do it in 24, that's even better, because the longer you're in the hospital, the hospital individuals are going to forget.
As an example, you go to the Detroit VA. You're having a heart attack and it needs to have emergent intervention. You were taken by then an ambulance to either the Ann Arbor, depending on how serious it is, or across the street to DMC. All of that is supposed to be covered because it's part of your benefits, and that's the piece that it's in your record. When you're admitted to another hospital, let them know you have VA benefits, because it's just like another insurance, plus any, and you know, Medicare, whatever, because they're going to want to get paid. And so that is important. So when you're admitted and they take down all that information, I have Medicare, I have this, but I am eligible for VA health care. Okay. Medicare, we've been paying into since we've been paying into, okay, for forever. That is still part of your benefits. And the VA will still use part of your Medicare, yes, because as the VA will bill any insurance company. That was not always the case. And the VA, actually, I started the VA in 2001 and they started doing that. The VA was actually losing money because they weren't acting like a health system. Now they are acting like a health system, and so they're recouping some of those costs from insurance companies. Now, depending on your eligibility, you will also have copays. But they can recoup a lot of the costs that are already covered by Medicare. So it's actually good for you. So I recommend that you do that.
But I would absolutely tell you, you must sign up for Medicare. And then let the VA, that would possibly will reduce your deductibles also.
Yes, very much.